On November of 2020, I experienced a pain in my right flank. I went to urgent care and they ordered a CT scan. I got a call a couple hours later to come into the urgent care. I knew something was up, and 2 seconds later, the doctor came in with a piece of paper in his hand and said, "You have cancer." When I was told I had cancer, I was also told that it went from my colon and metastasized to my liver. And it was all over my liver. So one of the early oncologists I had told me that my only option was going to be chemo for life, and she was going to make my life as comfortable as possible because I'd probably only live for 3 years. I decided that I was going to figure out a way to beat cancer and overcome it. And that was kind of what led me to learning about the living donor liver transplant.
My name is Roberto Hernandez Alejandro. I am the chief of the Transplant Institute and chief of the Division of Transplantation at the University of Rochester Medical Center. Colon cancer is the third most common cancer in the world. Unfortunately, colon cancer, 50% of the time affects the liver. And the majority of the time, these patients, they don't have too many options other than chemotherapy. Here at University of Rochester, we built a team dedicated to liver transplantation for colorectal metastasis. With liver transplantation in selected patients, we're able to offer them a much better survival, a much better quality of life, and some of them, they could be even cured. And when surgery is not an option for them, their only treatment is chemotherapy. And their chances of surviving 5 years, it's only 5 to 10%. We're the pioneers. We are the #1 program doing this with the very good outcomes. And this is just started 5 years ago.
I live in Tampa, Florida, and there's no transplant centers in Florida doing this for colorectal cancer patients. But also, I wanted to go to the place that I determined that, in my belief, was doing the best job for colorectal cancer patients with living donor liver transplants. And so that prompted me to really want to focus on who was doing the most, who was having the most success, and that led me to UR Medicine. So I had spent 14 months searching for a living donor on my own.
I'm Beth LaPerry. I've been a URMC employee for the past 23 years, a proud employee. I'm here because I made the decision to donate my liver. I was doing a non-directed donation. I didn't know anybody that needed one, but I wanted to donate. My intention was to deliver to whoever needed my liver. I ended up matching with somebody from Tampa, Florida, and that ended up being Tim. The feeling that I get from being able to donate to anybody it truly is immeasurable. To be able to help extend somebody's life for not only themselves, but the people that they touch is truly an honor. Knowing that my organ has actually helped, it's sustaining my life, but it's also brought him new life. It's incredible to think a piece of my liver is actually living, it's thriving in an individual that's doing amazing things with his own life. I feel incredibly blessed. This entire experience has truly been life-changing, not only for Tim, but also for myself, for my loved ones. I feel kind of like we learn what we live, and if more people saw people donating, the ripple effect would just be absolutely incredible.
Once we start doing this operation and seeing the success, the word starts spreading. Nowadays, we are the largest center in the United States.
Well, this week is basically my 1-year transplant anniversary of when I had my transplant last year. I feel absolutely wonderful. I just feel like I have so much more energy, am so much more alive, and really just embrace each day to its fullest as much as I can. I just want to thank Beth from the bottom of my heart for being willing to do this and be the angel that she is. It takes a special type of person to do something like this, and I don't think I could ever thank her enough.